Welcome to our podcast on endoscopic resection of Zenker's diverticulum. Today, we'll dive deep into this condition, its treatment, and the benefits of endoscopic approaches. Zenker's diverticulum is a rare disorder of the esophagus, primarily affecting elderly individuals between their 70s and 90s. It's more common in men and occurs in about 0.01% to 0.11% of the population, with higher rates in Northern Europe, the United States, and Canada. This condition involves a pouch forming in the hypopharynx, typically between the cricopharyngeus, CP muscle, and the inferior pharyngeal constrictor muscle. It's a false diverticulum, meaning it only involves the mucosa and submucosal layers, not the muscular layer. The exact cause isn't fully understood, but it's believed to result from abnormal pressure during swallowing, causing a weakness in the Killian triangle, the area between the horizontal and oblique fibers of the cricopharyngeus muscle. Patients typically present with a long history of dysphagia, or difficulty swallowing, which occurs in up to 98% of cases. Other common symptoms include regurgitation, halitosis, aspiration, and recurrent coughing. Traditionally, Zenker's diverticulum was treated with open surgery or rigid endoscopic techniques using a laryngoscope. However, these methods require general anesthesia, tracheal intubation, and are more invasive, leading to higher complication rates and longer hospital stays. In recent years, flexible endoscopic treatment has emerged as a superior option. This approach offers several advantages. 1. It's less invasive, reducing patient discomfort. 2. It requires a shorter hospital stay, typically around 2 days. 3. Patients can resume oral food intake the day after treatment. 4. It has lower complication and mortality rates compared to traditional methods. Now, let's discuss the key steps for performing an endoscopic resection. 1. Use of a transparent cap. This is attached to the endoscope tip. It stabilizes the view, maintains a safe distance from the tissue, and allows for precise incisions. 2. Ensuring clear visualization. The esophageal lumen and diverticulum should be clearly visible. If visibility is difficult, a guide wire or thin tube can be placed into the stomach to maintain a clear view of the esophagus. 3. Choosing the right tools. Various devices have been examined for this procedure. A hook knife is often preferred as it allows for controlled cutting and dissection of muscle fibers. Other options include argon plasma coagulation, different types of needles, stapling devices, and endoscopic scissors. 4. Performing the septotomy. This is done in stages. First, incise the mucosa, then the submucosa, and finally the muscle fibers. It's crucial to proceed slowly and steadily. The goal is to cut the cricopharyngeal muscle, which is the main objective of the treatment. 5. Safety closure. After dissecting to the base of the septum, place a closing clip at the apex of the dissection. This is the most vulnerable area for perforation. A clip with a short stem is preferred to avoid irritating the opposite wall. It's important to note that this procedure is challenging and should be performed by endoscopists with high expertise in therapeutic endoscopy. It requires special training, which can be difficult to obtain due to the rarity of the condition. The benefits of endoscopic treatment are significant. Patient satisfaction is reportedly very high, with patients appreciating the non-invasive nature, short hospital stay, and high rates of dysphagia resolution. Even in cases of symptom recurrence, the procedure can usually be repeated effectively. In conclusion, endoscopic resection of Zenker's diverticulum represents a significant advancement in treatment. It offers a safe, effective, and minimally invasive option for patients, particularly beneficial for elderly individuals who may have comorbidities that complicate more invasive treatments. As research continues, we expect to see more comparative studies between surgical methods and flexible endoscopy, further solidifying the role of endoscopic treatment in managing Zenker's diverticulum. Thank you for listening to this detailed exploration of endoscopic resection of Zenker's diverticulum. We hope this information has been valuable to both medical professionals and patients alike.